Hi.
Hi.
Tell us your name.
Meg.
Hi, Meg.
Hi.
Well, thanks for volunteering to tell your story and your experience here. What brought you here?
Some chronic pain in my forearm and hand.
What were your specific symptoms in addition to your pain? Did you have any numbness, tingling, cramping, weakness, anything of that nature?
Some weakness, perhaps cramping, but not very often.
And you noticed that that was correlated to
My menstrual cycle,
your
it
menstrual
definitely
cycle.
got worse.
It definitely got worse. So you have some periodic swelling that we may need to actually look at some additional things like some hormone levels. Did you seek treatment at other doctors' offices before or get a diagnosis?
I did. I went to a hand surgeon thinking, perhaps something is wrong internally to my arm, and they did a test for carpal tunnel and confirmed that it wasn't carpal tunnel, but didn't have any other ideas, and sent me away with the idea that I could come back and get cortisone shots, which I didn't want to do because I didn't want to treat it with something that is a treatment for something else.
Right, and something that may be temporary when we need to find a permanent reason. So you came to Dr. Kandilakis' clinic and had a very important metabolic workup where we looked a little bit at the previous values, and we did an EMG in which we actually did confirm, I personally did the EMG confirming some nerve temporary damage or dysfunction, right?
Right.
Right, we found the radial nerve. And we also did an MRI based on some of those findings looking further up at the spinal canal, and we did find that you had a herniation in your neck.
Yes.
And it corresponds to the same side that you're having your symptoms. So we put you on some treatment plan, and tell us how did the results go with that treatment plan so far?
It's excellent. I don't have the chronic pain, and there's a little bit still with my menstrual cycle, but not nearly as bad as it was. So I'm not even thinking about it. I used to sit and think about it at work and stretch my hand and go through these odd activities to relieve the pain. I don't have to do.
Oh, that's great. That's great. So what would you tell a potential future patient that may want to choose our clinic to try?
I definitely think if they have something that they're having trouble with, and they come in and it's something like what I experienced, that they'll have the focus and attention that is needed to figure out what the actual root cause of the problem is, instead of just trying to treat the symptoms.
Right. Well, thank you so much for sharing your experience, Meg.
You're welcome.